Hello, and welcome to Joan Comrie's Feeding Tips. My name is Joan Comrie. Today we're going to talk about how parents can identify whether their infant needs to have a referral for a tongue tie. Concerns about tongue tie weigh heavy on parents, especially if they have a baby that has a feeding difficulty. And that's usually the number one time or the easiest way that parents can suspect whether their baby has a tongue tie or not. And what a professional would look at for a tongue tie is what is the baby's range of motion. So we know that tongue tie can cause breastfeeding issues, it can cause pain during breastfeeding, it can cause nipple changes, and it can cause the baby not to be able to transfer enough milk. But how do you decide whether the baby just is not just fatigued, but actually has a tongue tie? So the first thing a parent can do is when a baby cries, look at what the tongue pattern is like, because we are looking for function. So if that baby is crying, you want to see their tongue fairly thin and cupped like this, a cupping motion of that tongue, and then you want the tip, which is that tip of the tongue, to be elevated to the roof of the mouth behind where their teeth would be if they had teeth. And so if a baby's crying and has a good range of motion, the tongue tip will elevate all the way to the roof of the mouth. That is one good way to see. Another way to see is if the baby can protrude their tongue to the lips. Now, a baby can have tongue protrusion and still have restricted range of motion and not be able to elevate, and that elevation is vital for successful breastfeeding. Another thing that parents can do is they can manually go in if you're comfortable. Now, don't do this if you're not comfortable, because every experience orally or in the mouth that a baby has needs to be positive, especially when they're newborns, because they don't have that many experiences to base their decision about whether they like things in their mouth or not. So if you're not comfortable putting your hands in or fingers in your baby's mouth, don't do it. But if you are and your baby tolerates it, what you can do is put the baby's head on your lap and the body somebody else can hold for you, and you can take your fingers and you can go in and manually lift that tongue and see if you can get it elevated to the roof of the mouth. Now, if you don't have the ability to get that range of motion, that is also a reason to suspect maybe there is limited range of motion, and that would be a baby that you could make you could go get a consult from an ear, nose, and throat doctor, an ENT, or a dentist, whoever in your part of town is the expert and does all the tongue revisions. So whether you get the tongue, so do you want to get that tongue revised, I guess, is another question that parents ask. And the literature supports that the revision, which is whatever the procedure is that the physician uses to release that frenulum, which is that string underneath the tongue, to give you better range of motion, that all of the studies, even done in the Journal of Pediatrics and some of the other very well medically researched journals, say that the tongue revision can be a very positive thing for babies, and there doesn't seem to be any negatives that the research is identifying at this point in time. So that will make it a little bit easier to decide whether you want to go ahead and have that procedure done or not. So I'm going to recap what we talked about today. So ways that you as a parent can try to identify whether you might need to send your baby or take your baby to a professional to diagnose a tongue tie, which would be the ear, nose, and throat doctor or the dentist or whatever other professional is going to do the revision in your part of the country. Things that you can do to look at is, one, when your baby's crying, is it a soft, thin cupping of the tongue that elevates to the roof of their mouth? Can they protrude their tongue forward, and do they have feeding difficulties? If they have any of those things and you try, because you know that you're okay and your baby's okay with you putting your fingers in your baby's mouth, and you can't get that tongue to elevate, that's another range of motion that the baby should be able to have good function for feeding. And if those things aren't in play, then it might be a good idea to go get a consult so that that physician can diagnose whether your baby has a tongue tie or not. I hope this is helpful. Have a great day.